This is Jerry Hesch of the Hesch Institute, and this is a brief endorsement from a massage therapist who came to the Hesch Institute for treatment, and she's interested in learning more about this treatment method, and this is Tammy.
Hi, I'm Tammy Wooler, and I've been doing massage therapy for almost 20 years, and I have been trained in some advanced techniques, most recently Eric Dalton, which is how I found Jerry, and I'm very glad I found Jerry as a patient because 2 years ago I was involved in a sledding accident which I hurt my pelvis, my low back, and I wasn't able to recover, even with several different modalities, including massage therapy, chiropractic. In fact, I've seen 3 chiropractors, probably 4 massage therapists. I've seen 3 other physical therapists, orthopedic surgeon, and osteopath. And although everybody contributed to my injury in some small way, my whole body has never been addressed like Jerry has addressed my body from head to toe, which both fascinates me as a patient and mostly as a therapist. I just have never had the attention given to my body and the expertise that Jerry has offered to me has been unbelievable, to say the least, because 2 years of suffering with feeling like I'm walking sideways and leaning to the side and being called normal by physicians according to my x-rays, etc., has been very emotional and frustrating. And this healing path is, I feel that with the video that he offered me and took some time to talk to me about different techniques I can offer my clients, I just can't wait to learn more from him. And in fact, I want to invite Jerry up to Idaho, and so that I can reach out to my physicians and physical therapists and chiropractors so that they can see through my experience what Jerry has to offer.
Can you describe briefly how this work is different from anything that you've received?
This work is different because everything's analyzed so specifically through the spring testing, and it's not just a treatment of the low back, it's how dynamic my body moves in space and what compromises, what, it's not, I don't know how to explain it. It's just, he looked at my whole body and not just, alleviating just my back pain, because it had to do with my feet, my pelvis, my upper cervicals. It wasn't just a simple fix or a long-term strategy.
Prior to coming here, how many massages since your injury would you say you've had? How many chiropractic visits? How many physical therapy visits? Just a gross estimate.
At first it was chiropractic probably 2 or 3 times a week for a few months, and I would become a little frustrated and not getting better or improving like I have in my life, so I'd move on to a different technique or a different physician. And then it was at least once a week for the first year of chiropractic. And then physical therapy was really frustrating to me because I felt like they were trying to work my body with weights and exercises when I knew instinctively that it was building bad patterns of movement around my injury. And so, I mean, I've been consistent on care and seeking solutions for over 2 years, and spent a lot of money on that and a lot of my time. And it's cost me a lot of money also not being able to do my work.
In terms of out of pocket, what would you estimate? Just a gross estimate.
Well, actually, we did look at that, and at least $4,000.
Okay, and how much?
And that's billed insurance as well. So that's, meeting deductibles and co-pays and.
Interesting. Yes, so it is a much larger amount
Right.
than that.
Yeah.
And how much massage have you had since the injury?
Well, honestly, massage was something that would kind of throw me into spasm with the instability in my low back. So I would be really careful getting, the regular type of massage when the therapist didn't understand what was going on. My partner in my office and I would play around with some different things. And, massage wasn't probably the most sought after therapy.
Mm-hmm. Interesting.
Because I felt, that it was maybe a bony issue or something. And I don't know a lot of therapists that, in my area that would be able to handle that.
And then the last, I had another question floating around. And, how do you feel now with respect to being able to manage on your own?
That's what I have appreciated probably the most, is the video that you made for me at the end. And that has gotten rid of the whole hopeless feeling of me not understanding and wrapping my mind around it. And what you say totally resonates with me and what I have felt in my body. And so having that homework video is like worth $1 million to me, because now I can take control of my body with the knowledge of what's really going on with it.
And when you walked in the door, you felt a certain way, and now when you're leaving, you feel a certain way. Could you briefly compare and contrast that?
Like physically or mentally or both?
Stay with physical and then do mental.
Okay. Well, when I first came in here, I was leaning to the right and twisting to the right. I felt like I was walking sideways. My body did not feel strong in its structure. I couldn't understand what was going on. I didn't necessarily have a lot of pain, but I had a lot of dysfunction. And it bothered me to work with that dysfunction. So.
And then mentally or emotionally?
Mentally and emotionally, I've been really fed up with being told that there's nothing wrong with me. And so I had a lot of fear coming in that that's what Jerry was going to find in me, because that's kind of what I've been told. But I was in hopes that somebody would see what I was talking about when I said I'm twisted or I'm not functioning right. And he was able to pick up exactly. In fact, he would come outside the treatment room and kind of close his eyes and do what my body would do so that he could understand what my body was doing. And I looked at him and saw myself completely.
Interesting. I didn't even know I did that.
Yeah.
So that tells you a little bit about how much memory I'm running on. But I like hearing that. I'm happy to hear that. So anyway, we hope to take this work out into the community. We are doing it on a small scale. We're a small organization. And we feel like we have a unique perspective on the body it doesn't take away, but rather is additive to the care that's out there. And I appreciate you doing this for me.
Yeah, I just think that if any massage therapist who does advanced work, this is something that is just amazing. I just can't. I'm hungry for this information. So
Thank you very much.
thank you.